Hi, everyone. I want to just give you a little bit of kind of a mini lecture on your stress chapter, just to kind of clarify some of the terminology and how we actually categorize stress, how we actually define it, and then how we have our stress and traumatic disorders. Adjustment disorder, acute stress disorder, and then PTSD. So let's take a little look about how we're kind of defining stress. I asked this of my class. I said, if you could write things on the board that dealt with stress, what would be some of the things that you would put up there? People put like people, money, school, job. So those are typical aspects of stress. But when we look at stress in our field, we think, what adjustment demands are you making in your life that kind of equate to how stress affects you? So anytime you have to make an adjustment demand, that can end up being a stress, or what we call stressors. When you look at stressors, if you look at how we actually categorize it, and how you're reading it in your chapter, we put all of the psychosocial stressors on axis 4. So you have axis 1, which deals with all your clinical conditions, and then axis 2, you look at personality, axis 3, you look at medical conditions, axis 4, you look at psychosocial stressors, and then axis 5, which is your global assessment functioning. And again, this has an effect with stress as well. So let's kind of look at stress. And we know adjustment demand. Adjustment demand can lead to a stress, and those are your stressors. What is important when you're working with patients and you're trying to make that assessment is to try to categorize their stress. That will really help to kind of put it in perspective. So if I am talking to someone and someone says to me, there's a conflict with the people that I work with, there's conflicts at home, there's conflicts in my life, I'm having conflicts, well, that's a category. So that's a conflict. And that kind of helps me to kind of put it in that particular area. Then I can go to the nature of their stressors based on conflict. So some people might be under pressure, and that stress of that pressure, talk about adjustment demands. And then when you look at frustrations, a lot of people get frustrated, and frustration, as you know, Drive 98, that can cause a lot of frustration. So when you can talk with someone and you kind of put it into a category, that gives you some perspective to lead on to the next set of questions. Well, then you have to look at the nature of that particular stress. So they have conflicts, if they have pressures, if they have frustrations, they're going to tell you those narrative stories. And so you can write all that stuff down. You're going to have something to go on. But then look at the nature of the stress. Because for some people, what is important to some people may not be to others. So I may not think, it's very stressful to drive 98, Highway 98, but somebody else might feel that it's very stressful. So you have to look at the importance of the stress. You have to look at the duration of the stress. How long has it been going on? So if somebody says these conflicts, well, how long have these conflicts been going on? Because that's good information to know. The importance, multiplicity. Is it a lot of different things? Is it one stress after another? Do they have like an order of it? I asked my in-class, I said, if I had a list up here, your stressors, what would you put down? Of course, people, was first, and then, school, and then money, finance, all that kind of stuff. So you have to look at the importance of that stressor, the multiplicity of that structure, of the stressor, the duration of how long they've been dealing with it. Is it accumulative? Is it one thing piling up over another? Because this tells you the adjustment demands that someone has to go through every single time. So based on the categories, based on the nature of the stress, you also have to make a determination of whether or not it is a crisis for someone. And when we think about crisis and crisis intervention, everyone has coping skills and resilient skills, but are they running out of those coping skills? Are they to the point where it's such a crisis because they kind of feel like everything's out of control? So when you look at stress, these adjustment demands, which can become stressors and lead to stress, can start to build up. And that's where we start talking about our category of trauma and stress-related disorders. Now, the changes that went into the DSM-5. They actually made some changes. An example, PTSD. PTSD, for as long as I've been teaching abnormal psychology, was always in the anxiety section, anxiety disorders. But due to the nature of PTSD, and we see it, we've seen a huge amount of diagnosing with PTSD, that is now in its own category. So we have adjustment disorder, we have acute stress disorder, and we have PTSD. I just want to briefly tell you a little bit about some of the diagnostic criteria. Adjustment disorder. If you had to give someone the lightest disorder, it would be adjustment disorder. Remember, and for the test, adjustment disorder is to any life changes. And if you had to think of life changes, you would think of something like a job, maybe moving, a divorce, maybe marriage. Those are life changes, and they're adjustment demands. And most people can work through it. They have the coping skills, they kind of deal with it. But some individuals have difficulty with that. So according to our adjustment disorder criteria, we look for any type of life-changing stressors within a 3-month period that's causing, difficulty for that person to move forward. And so you're looking at, say, for instance, a divorce, or say, for instance, marriage, or even moving. And so they're having difficulty making that particular adjustment. Now, once it continues, so you reevaluate the patient in 6 months and you're seeing that they're still having difficulties, they're not adjusting, well, you have to kind of rethink a little bit about the disorder. So with the criteria, there can be subtypes with that criteria. So you're thinking about 3 months within a 3-month period, and you're looking at a 6 months, evaluation. Some people do experience subtypes, adjustment disorder with. Some people do experience some depressive symptoms, but that does not mean they have depression. You would reevaluate that. Some people deal with anxieties. If you are moving, are you changing jobs, or your whole lifestyle is changing, that's a huge demand. There could be some anxiety, and also to behavioral disturbances. So sometimes people do things they wouldn't normally do because they don't know how to adjust. And so I may write down the criteria for adjustment disorder, subtype, depressive symptoms, anxiety symptoms, behavioral symptoms. And so again, I would reevaluate that. When it comes to the other two, which you guys need to read, excellent chapter, you have acute stress disorder and you have PTSD. Usually with acute stress disorder, the symptoms come on within a couple of days. And they're a little bit different from PTSD in the fact that people are more numb. It's like a numbing effect due to the traumatic event. So people may walk around in a daze, may walk around in a fog, but usually within 2 days, you're starting to see this numbness, this kind of detachment. 2 words you need to become familiar with: depersonalization and derealization. And when you think of depersonalization, think of kind of a out-of-body experience. How many of you guys have washed your dishes, but you were thinking about something else? You kind of watching yourself see it, but you're not really doing it. So you're kind of like going through the motions. When you look at derealization, you're looking at, it's kind of that example with movies. Have you ever watched characters where they're like walking down the street and they're walking really slow, but then everything else is going by really fast? It's kind of like you're in a time zone and everybody else is going, and so it's kind of like a movie going on and you're kind of just in slow motion. So you see that within that acute stress disorder. So it's that numbing effect. There's bits and pieces missing, some amnesia. The quicker the intervention, the greater the results. So that is why when you see a lot of people that go through natural disasters, they will have someone in with like the next couple of days. If it prolongs past 4 weeks, if you see this depersonalization, this derealization, this amnesia type effect, and it's starting to affect them to where there's intrusive thoughts, there's avoidance, you have to look at PTSD. By criteria, and you've read this in your chapter, once it goes over a month, then we have to look at PTSD. And if you look at that section, it's an entire page in your chapter. You will see all the way from A to G exactly the criteria for PTSD. But A is the most important. If you don't get past A, you don't have PTSD. You must witness, you must experience, or the sudden death of a friend or loved one. There is 4 criteria right there in A. If you don't meet that, you're not going on to the rest of it, because we had to get pretty strict about that. Watching TV and watching a movie is not accountable and credible for PTSD. You have to witness it, feel threatened yourself, or this is the new part, the sudden death of a friend or a loved one. Unexpected, unexpected. So look at the criteria, look at that page. And when you look at Veronica, I mean, look, this is a perfect case study. When you look at Veronica, you can see she almost meets every single criteria, but she meets the first one. And because she meets A, then you can move on to B, C, and go all the way down. And she's meeting all that criteria. So this is a really good case study, because it also gives you an idea about how it's that sudden death, and so it meets the criteria for the DSM-5. So go back through, look at the criteria. Adjustment disorder, remember, life-changing events. Acute stress disorder, trauma, and then PTSD, trauma. And the difference with acute stress, you're going to see those symptoms within a few days, but after a month, we have to go to PTSD. So go back over and read that. And what I'll do is I'll make another video that kind of talks a little bit about the anxiety, because I need to tell you the difference between anxiety and fear. And so that's going to help you to understand how many individuals who suffer from PTSD also deal with anxiety disorders as well. So it's the comorbidity. You see dual diagnosing specifically with this. So go back over. And I'm gonna email you my number just in case you guys have problems. I know there's some problems with the D2L every once in a while. Just let me know that. But again, go over and look at the criteria, and then I think you'll be okay. So good job.